care for children with broken bones and limb and joint problems, whether they're congenital or developmental. Each treatment's going to vary depending on what each patient has, but often we'll start with non-operative treatments first, whether it's simply some home exercises and stretches. And then at times we'll need to go to surgery. We usually try and reserve that to the last resort if everything non-operative fails first. But often we can treat them with either casts or therapy and get them better. There's a different feel and a different approach in the pediatric side versus the adult side of orthopedics. They get to be in a clinic full of other kids, so they're not stuck around a bunch of older adults while they're waiting to see the physician. And then they get very much a pediatric-centered care with the parents' involvement to modify it, because treating a 3-year-old is a lot different than treating an adult. So in kids, the biggest difference in treating bone diseases and or injuries is the fact that they have a growth plate, and so adults no longer are growing, and so therefore require more surgeries. In the kid side, we're able to get away with less surgeries often. However, we do have to respect the growth plate, and so it requires a different type of treatment, often requires sometimes different types of casts, and if they do require surgery, typically we have to do a completely different surgery in order to avoid the growth plate and therefore not affect their later growth. And so they're completely different surgical techniques within children. Kids are just much more fun and interactive in the visits. They also come at their processes completely different than adults, so they have a more fun approach. The questions they'll ask, I should say, are often very interesting and often very to the point, and makes it a lot more fun to treat kids than adults.